I was quite young when I first heard the word kidney. My father is also a nephrologist, and so very early on, our dinner discussions would center around some of his experiences as a physician caring for patients with kidney disease. I do love the kidney. I call myself a nephrophiliac because it does so many things. It's so complicated. I love math. You need a lot of math to understand how the kidney works. And it's linked to every other system in the body. And so being able to care for a patient with kidney disease, I'm also caring for their entire health, their blood pressure, their electrolytes and fluid status, their bone mineral health, their anemia. It's linked to every system in the body, and so it really allows me to take care of the whole patient. So I was awarded the Sharon Award from the ASN Foundation, and it was my first time that I had ever received a research grant. So it really gave me a lot of confidence to push forward on research ideas I had been thinking about and writing about when I was getting my master's during nephrology fellowship. And so receiving that award really was foundational for starting my research career. I do have a focus on health equity and ensuring that all patients have access to educational materials about the treatment choices that they make, to improved quality of life. And there's so many disparities within the field of nephrology, specifically within the field of palliative nephrology, and I hope to change that with my research. When I was doing my clinical fellowship in nephrology, I realized that many patients with kidney disease would get quite sick quite fast. And spending some time in the intensive care unit, I would see that patients with kidney disease really weren't prepared to have end-of-life discussions, to make medical choices such as CPR or feeding tubes. I really thought that we could be doing a better job as nephrologists assessing patients' preferences and preparing them earlier on in their disease course to have those conversations. So the people before me, my mentors, my advisors, my collaborators, obtaining research grants early on in their career was very inspiring for me to hear, because when you first start research, you really feel like you don't know what you're doing. And so having the guidance of people before me who had obtained research grants, there's too many to name, was very, very helpful for me. And then in turn, I'm hoping to pay that forward for people behind me who are asking the type of questions that haven't been asked before. And that was something that was novel about the research that the ASN Foundation awarded for me, was that it was a question that had really never been explored in nephrology. And so giving the confidence to someone behind me to say, yes, I can do this, yes, I can study this, and yes, I can change the field is really special.